Welcome to Webisode 13, where we will discuss the duties of an opioid treatment program medical director. I'm Eric Morse, an addiction psychiatrist who's been working in opioid treatment program settings for over 18 years. Above all else, the medical director of an OTP should serve as the leader of the medical team at their facility and set the tone at that OTP. Medical directors should understand opioid use disorders and substance use disorders and be comfortable around patients with these chronic illnesses. They should help develop a treatment team milieu that is warm and welcoming for all patients and free from judgmentalism. They should educate employees, both medical and non-medical, about this chronic illness. They should set an example by exhibiting attitudes of acceptance and compassion for all patients, no matter the progress or lack of progress made by patients engaged in treatment. The federal guidelines for OTPs state that medical directors must be licensed physicians and have completed a residency training program. The guidelines also recommend directors have at least 1 year of experience in addiction medicine or addiction psychiatry. Board certification in addiction medicine or addiction psychiatry is preferred, but not required at this time. Medical directors must make sure that all medical services, nursing services, and toxicology services are provided at the OTP in compliance with federal regulations. The federal guidelines recommend that medical directors take the 8-hour buprenorphine course, even if they don't plan to prescribe from an office-based practice, in order to better understand these practices and coordinate care with them. The medical director should spend sufficient hours at the OTP to assure regulatory compliance and carry out those duties specifically assigned to the medical director by regulation. According to the federal guidelines of opioid treatment programs released in January of 2015, this means medical directors need to have enough time to accomplish the full scope of their job. This may include doing patient admissions, histories and physicals, seeing established patients for dose adjustments, checking for medication side effects or interactions, and the supervision of other OTP physicians and physician extenders. Medical directors also supervise the work of nursing staff. If services such as psychiatric care or primary care are also performed at the OTP, the medical director should supervise those as well. Medical directors should have strong presence as leaders in their OTP. Directors should help educate the medical professionals they work with about addiction medicine. Directors should encourage medical professionals to read new material about the field and go to regional and national conferences about addiction medicine for further development of knowledge and competence in the field. Medical directors need to provide guidance to staff about how to do guest dosing, patient exceptions on the SAMHSA extranet, dose titration, and decisions about take-home doses. The medical directors should make certain that only medical professionals are making medical decisions and remain in their scope of practice. While some OTPs in North Carolina are owned and operated by physicians experienced in addiction medicine, many are not. Some OTPs in our state are owned by non-physicians and organizations. For this reason, a strong medical director is needed to push for quality care in such OTPs, because owners cannot be expected to have the needed medical expertise, like the need to test for newer illicit drugs like fentanyl or gabapentin. It's important that owners understand the value of our monthly teleconference held by SOTA for physicians and advanced practice providers to review updates and discuss best practices. Owners should allow time in the provider schedule to participate. The medical director needs to advocate for change in program operation when needed. The medical director needs to perform or oversee the process of communication with the patient's other medical care providers, whether the OTP communicates with other medical providers in the community by letter, phone, email, or exchange of medical records. The medical director must ensure the OTP has a process of communication and of documentation of the communication. The medical director needs to assure that all patients are screened with the state's prescription monitoring program, known as the North Carolina Controlled Substance Reporting System, or CSRS, on intake and regularly thereafter. The STOP Act passed by the North Carolina legislature in 2017 required patients be checked once per quarter, with the ability of the prescribers to designate delegates to check the PMP. The workload on the physician can be greatly lessened. The medical director at an OTP has an obligation to educate the community at large about the nature of opioid use disorder and how treatment with medications help reduce death rates for opioid overdose and help citizens regain productive lives. This may be a slow process requiring repeated outreach to the medical community, including local hospitals, health departments, mental health agencies, and other interested parties. Medical directors can also consider doing educational outreach to churches, community groups, and law enforcement agencies. In summary, medical directors must attend to all aspects of OTP function, from the smallest details about how the patients are dosed to larger considerations such as the OTP's reputation in the community. It's a big job with opportunities for big rewards. If you have further questions, feel free to contact your state opioid treatment authority. Thank you for watching, and keep up the good work.